Welcome to The Other Side, Mississippi Today's political podcast. The Other Side lets you hear directly from the most connected players and observers across the spectrum of politics in Mississippi. From breaking news to political strategy to interviews with candidates and elected officials, we'll bring you facts, perspectives, and context that helps you cut through the noise and understand all sides of the story.
Welcome to The Other Side, Mississippi Today's political podcast. I'm here today with my colleague, Taylor Vance. Taylor, hello.
Hey, Geoff.
How are you?
I'm good. How are you?
Doing well. We've got a special guest today. I think he's been on this podcast at least once before. Man, kind of in the spotlight right now, one of several, but we have Representative Sam Creekmore from New Albany. Welcome. Thanks for...
I'm always glad to be here, and y'all have always been kind to me, so thanks for having me back.
We'll have to work on that.
Well, Taylor hadn't always been kind. But
Right. Representative Creekmore represents District 14, Union County. You are in your second term.
Yes, sir.
Beginning of second term, and the relatively newly minted chair of public health, big important committee in the House.
Well, all of them are important, but yes, I'm proud to be in public health. I'm enjoying it.
Okay. And one other interesting thing you've been tasked with, you are one of 6 conferees on to try and work out a deal between the House and Senate on Medicaid expansion. I know we're kind of in the early phase of those negotiations. Can you give us a quick thumbnail of where that stands?
Sure. And, the House, as y'all know, has been working on this from really day one.
Sure.
And not that I've been involved in every day of it. Missy McGee, Chairman McGee, has done an incredible job on the House side, along with Speaker White. But being in public health as I am, I have a very keen interest in this, and always have since I've been in the legislature, for 5 years. So yeah, it's moving along. It's kind of, we're down to the conference time. So I am one of the 3 on the House side, along with Joey Hood and obviously Chairman McGee. And so I'm following Chairman McGee's lead. And so next week we will be having hopefully some discussions. And as the speaker said, that they will be public. So
sure.
Sure.
A fun fact that I think people may not know is you and Representative Missy McGee share the same room for an office suite in the Capitol. So if she's not too happy with what you're doing, I guess, on the conference committee, she can come and sort you out probably.
She doesn't have to go far. I'll know it pretty quick. So
yeah. So what I guess, when do you think that y'all will have a meeting, or I guess, has she been kind of talking with Senate Medicaid Chairman Kevin Blackwell?
Yeah. Chairman McGee talks every day about Medicaid with. Yeah. I don't know, with the Senate every day, but every day she's working on it and working hard. And then she and I have had, obviously, sharing an office suite. We have conversations daily. So,
gotcha.
Yeah, she's the lead. I'm following whatever she goes. And, of course, Jason White, our speaker, has done a great job, and he kind of sets the standard for us and backs us up. So,
sure.
That's kind of where we are.
We spoke with the speaker about that here recently, and one thing that I guess he made clear, and I think Chairwoman McGee has made clear, seems like y'all are gonna stand pretty firm on the going to 138% of poverty level, and thus drawing down federal money.
Well, I like to break this Medicaid reform into 3 parts. One, let's just talk about the deal, the money deal. And if I'm going to give you $10 and you're going to give me $100, I'm going to take that deal all day long.
Right.
And that's the 90-10 match. That's what we're looking at for the federal government. So just from a financial standpoint, that is a great deal.
Yeah. And
on top of that, I'm not even going to give you the $10. Taylor's going to give you the $10, and you're going to give me $100. So the government, The Mississippi government is not ponying up the 10%.
Right.
It's coming from the hospitals or private industry. The second part of that deal, there's also a bonus of an additional $7, but in our case, $700 million that would come to the state just for signing up, and that would be over 2 years. So, who, just looking from a financial standpoint, who would take that deal? Everybody. All right, set the deal point aside. Let's look at it from a humanitarian point of view, or from public health point of view.
Sure.
We're the least healthy state in the country. Diabetes, we're overweight, we're out of shape, just obesity, just so many things. And all these are preventable. Most of them are preventable. And therefore, why are they not seeking treatment till it's too late? Well, a lot of them don't have insurance. This would help solve that humanitarian health problem that we have in the state of Mississippi. So, all right, set that bucket aside, and let's look at the third point, which is our healthcare system as a general. And for years, y'all been reporting on the failing healthcare system in Mississippi. Is it because we have bad hospitals? Not necessarily. Because we have a doctor shortage, yes. A nursing shortage, yes. We've reported on that. The legislature's addressed a lot of that, but it's still not enough. And back in the 80s, Ronald Reagan told the hospitals in the EMTALA, I believe that's EMTALA, said your hospitals are required to take someone who's sick, whether they can pay or not, and be able to get them to where they can be released. Who pays for that? The hospitals do. So with that mandate in place, and the hospitals are failing, this money would only help support them. It doesn't solve everything, but it helps. So if you combine all those three factors into this, I can't find an argument why this is not a good deal for Medicaid reform. It would help all the above. And it's a good deal. It's better for our people, and it would help our hospital system.
I guess sort of backing up, I know that you come from a family, a lot of physicians, medical professionals. Does that give you a little bit of a different perspective on this issue and maybe just healthcare in general, just coming from that background and growing up with that mindset?
I believe it does. You know, I've lived it my whole life. I've been there. My father's a family practice doctor, many times without a partner.
Yeah, he was at. I believe he was at the Capitol.
He was
week.
at the Capitol, and everyone was so gracious to him, and he loves coming to be the doctor of the day. And he loves service. Period. But you know, doctors, or especially when I was growing up, were accessible to everyone. You know, and he worked the hospitals, and the police would come get him at 3 a.m. to go deliver a baby, or phones ringing all the time. So, yeah, what I thought was a normal life really wasn't. But yeah, and you go out to eat, and people next door come over, come look at this sore on my arm, Dr. Creekmore. So
does this look infected?
You know, yeah, I know. So it was, yes. It gave me a different perspective on it, and typical, like the shoe cobbler's child was the one without a shoe. I was the last to be treated, or my brother was. So, but I grew up around it. Hospitals, clinics. I was always there. So yeah, I'm very sensitive and in tune with it.
Well, and to kind of shift gears a little bit, something you've been really involved in, I think even predating your chairmanship here, is mental health, and what would appear to be some clearly needed reforms. And I know you've advanced a really important bill that, as I understand, is still out there, still being worked out. House Bill 1640. Am I naming that
That's correct,
correctly?
yeah. And this really piggybacks on what we'd done a year or two ago with House Bill 1220. And it just takes it a step further. We're still implementing 1220. It was a 4 to 8 year process and getting everything taken care of. So, and so not all the data is in on how well that's performing yet. But 1640 takes it a step further. And a lot of what we've discovered in the mental health realm is there's not a lot of accurate or up-to-date data. 1220 addressed some of that. 1640 this year takes it a step further, requiring the community mental health centers to report to their supervisors. That's who pays them part of their salary. And the supervisors need to be aware. And this is things like occupancy, your cash balance at the end of the quarter, number of individuals who've been diverted, number of individuals who were declined. But that, the supervisors need to know they're part of it. So that will be reported to them quarterly. And then the civil commitment process. We're rearranging that. We're moving the evaluation part of it to the front, which seems logical to probably most of us.
Sure, and maybe we should point out one huge problem we've seen in Mississippi that you and others have been working to address is that so many people with mental illness, while we're trying to find them help, they get put in jail.
They do.
We're pretty much the owner, one of maybe 2 states that really does that.
That's right.
And this level.
And some are breaking a law and will still end up in jail because they're trespassing. Right. But we're still trying to navigate that. But having that evaluation move from step 3 to step 1 is a big part of that. For instance, if Taylor is at home visiting over the holidays and his mom is tired of him, she can go down to the chancellery's clerk and say, my son's mentally ill, and they'll go pick him up and take him, and he's supposed to be evaluated. With this process, they come evaluate him at wherever he is. If he's at home, whether you were mentally ill or not, Taylor, which we both know you're in good health. I was
going to say, you've used me for a lot of examples in this.
Well,
so far, I'm paying Geoff $10,
there's a little payback for that first article you wrote about me. But it's okay. It's okay. We're good. But anyway, the evaluation. So the CMHCs send an evaluator to wherever Taylor is. So he's at home.
Yeah.
And they go evaluate him, and it turns out, well, he's fine. Yeah. So then the process is stopped right there. Or Taylor is sick, and so, or if he was sick and violent, the police can go with the evaluator to make sure he or she is safe. So that's just a logical change in the process, and there'll be some growing pains from that. But that evaluation piece is big. So that's part of it, and that helps streamline things. If a patient is trespassing, it's 1 a.m, and they're mentally ill, maybe even on some substances, they will be picked up and will be taken to jail.
Yeah. And
there are repeat offenders, and many of our local law enforcement know who they are and know kind of what to expect at that point. But in 1640, they can only stay there. If they've broken the law, they're subject to the law first.
Right.
But if they'll be evaluated in jail, and many times the charges will be dropped. Doesn't have to be dropped, but can be dropped. But on hour 25, if they're still in jail, they have to get permission to extend it another 24 hours, and that's only if they're violent. So the CMHCs have to come treat whoever is picked up in that 24-hour period while they're in jail for breaking the law. So that's another piece. We changed the timeline for hearings. We shortened the timeline to 5 to 10 days. I think it's currently 2 weeks.
Okay.
So that will help. And we're also saying that law enforcement can deliver a patient across county lines. So as y'all know, I think we have 13 mental health regions, and we have 82 counties. Yeah. So some regions have 7 or 8 counties. And so if something happens in Union and there are no beds available, which there's not, they could take them to Lee County or Alcorn County, and at the county's expense, but it's cheaper than holding them in jail. Yeah. And plus, they're going to keep them in jail for 24 hours if they've broken the law. So we are addressing the transportation piece in that. The Senate bill had a mental health bill, and Nicole Boyd was the author, and we've taken some pieces out of that one. And one of them is the performance audit for CMHCs. And as we've talked before, and as we've studied mental health, there are a lot of really good pieces in place, but we don't all communicate together.
Right.
We have Department of Mental Health has developed a bed registry, which is real time, and so anybody
You can know where the resources
can know
are,
where the
right?
resources are, and so part of this performance audit is each CMHC we'll be able to go in there and tell, are you using that real time bed registry, and are you not, and several other factors in that haven't completely been developed, and it's not the legislature's prerogative really to develop the performance audit, but just to kind of set the guidelines. The Department of Mental Health will do that. But that will help decision makers and people like y'all be able to say, well, these people aren't performing well. And then I think we'll have a grade system, much like the schools. Region 3 is performing an A, Region 12 is a B, so that will help. And and plus the supervisors who help pay for their mental health services will be able to say, why are we a C? What's going on here? So a lot of that will, I think, will help in the communication and help hold people accountable. So that's a big part of 1640 is accountability and data collecting, and also trying to streamline the process. We're currently in conference with that. Ryan is a leader on the Senate side and a strong advocate for mental health, and has been a great champion for this. And both the House and Senate have worked well together on this issue. So we've hammered most of the details out. We're close to getting a conference report done and getting this to the governor.
Okay. Now, I know that's one of only quite a few things still on your plate, correct?
It is. We start out the year with almost 200 bills in public health.
Wow.
And so we end up, I think, getting maybe 30 out to the Senate, and then I think they sent us, maybe 12, 13. But we've met, we kind of divided up and prioritized, and we've had some pretty good, some really good, I think, legislation out that will help people. We got the seizure, House Bill 346, the Seizure Safe Schools Act. People with epilepsy or who having seizures, there's a new technique where you can just do a nose sniff instead of an injection, and it's amazing how well it works. And that's get children treated quicker in schools, and it'll be administered by a nurse who watches a video. It's really simple. I've seen it demonstrated. It's pretty cool. So we have that bill, which will speed up that process. I think y'all reported on this. The prior authorization was one of the top priorities and I think we took care of that the second week of which is
early on,
especially in the first session, is very unusual for us to be taking up bills and passing them that early. But it was a priority for both the House and the Senate, and the governor's already signed that one. But that helps streamline the process, and I think is a major bill. But as y'all know, insurance, we have prior authorization. If you go in for some blood work or for a certain test prior to this bill, you had to get prior authorization, which may take months.
Right.
And this bill puts time limits and breaks into three categories. Emergency, which there is no time, you have to receive it immediately. Non-urgent, I think we've made it 5 days. This has been 3 months ago. And then urgent was 24 hours or 48 hours. So just streamline that process. It enables the doctors to get their monies. And if there's an appeal process too that was sped up. And actually when if a doctor in cardiac realm of medicine, if there's an appeal, then he has to speak with another cardiac doctor for the insurance company.
Not someone in pediatrics.
Not someone in accounting.
Right.
Yeah. So that was a big deal. The psychology compact, where our psychologists can do telepsychology or telemed with people all over the United States, and vice versa. that was a big one. And there were two that I was very proud of. Actually went to insurance. They were my bills. And one, people with metastatic cancer, insurances have a step process where we'll start with this medicine, which may be the generic or the least effective, and you have a time period, and then you can go to the next step, and then you go to the next step. This is people with advanced cancer. They can skip that step process, and this one has been passed, and the governor has signed it, and so they go straight to the best drug, and that helps save lives in Mississippi, and it could be, you can imagine being very frustrating having to go through a step process when you're in pretty serious shape. But that would House Bill 1143, and the Senate was very gracious. Walter Michelle was very
and again, that was your bill, correct?
Yes, sir. But it did not come through public health, but it involves public health. And then we had another one for breast cancer, not breast cancer, but from mammograms and the testing. And our data shows that a woman goes in or a man goes in for a mammogram, and 20% of them are called back when maybe the test wasn't good enough, or maybe they saw something and needed further testing. 1 in 5 of those 20% of that 20% that have to come back actually go back, and many times the insurance company, many times the insurance companies doesn't cover the second visit. And so it's for economic reasons that they do not go back. And, that just leads to just pushing the disease down the road. And eventually they're going to come back, and it's many times can be more serious. This bill mandates that they pay for the second visit, which in the long run saves money because it can prevent. Again, we're going back to what's preventable health in Mississippi. That bill obviously passed the House and went to the Senate. For some reason, got caught up in some stuff, and y'all know how that can good bills can sometimes not get brought up for whatever reason. And that's what happened. Well, the Senate sent us a bill, which is a great bill, on it's the last act. It enables. We have a right to try law already, where you can try new things. What medicine's constantly changing, and this bill allowed individualized treatment through gene therapy. And so your genetic code is obviously different from mine, and so the way medicine has progressed, an individualized RNA, DNA gene therapy for your illness can be developed. It's expensive, but it's your last ditch hope. And currently in the state of Mississippi, you can't do that. Well, we were able to pass this. They passed through the Senate. We passed through the House. And this is a long story to get back to. We added an amendment on the House on the mammogram. To this bill, and both of them, it's germane. They're life saving, extends lives, and pass it through the House. Jerry Turner was very instrumental with the House side on the insurance side, and the Senate concurred. So this is going to the governor. Both of these bills can help save lives, and that's kind of it's a unique sometimes how laws work and how a bill's alive until it's dead. Right. But that I was proud to see 1144 House Bill 1144, which is now attached to the Senate, but still alive, and that would help save some people's lives. So that's kind of there were many other ones. Rare Disease Council was set up through UMCC, and there are 30 million Americans that have rare diseases, and this goes back to that gene therapy thing too. But half of those are children, and UMCC does some of this, but we've created a council that will help with this, and I think this will help as they continue to study this, help us with the insurance and develop strategies, and just like the gene therapy to help combat these rare diseases. I'm monologuing here, so y'all stop me.
No, go for it.
You know, this kind of goes back to Medicaid reform. You know, the federal government has many programs, and the Child Protection Services brought us a program that, you know, if we'll qualify for a certain treatment, I think I've got it right here. If we can be certified as a Qualified Residential Treatment Program, QTRP. There are lots of acronyms in mental health and in public health. If we can qualify with this, it opens us up for several federal dollars that are free. They're sitting there. Other states are getting them. And this is for people who are children who've been traumatized. And we don't necessarily have all the facilities, and so we send them out of state and to facilities. They've had a traumatic experience at home, and they go help out of state, and it costs us, you know, millions of dollars in our state because we don't have this QTRP qualified program. So we passed a bill, and so we have the ability and actually have facilities, but we had to have that designation. And we can be able to keep children in the state of Mississippi. They can get their treatment, and most of it be paid for by the federal government. And, you know, these are small things that, you know, I wasn't even aware of.
Yeah.
But, you know, if we pay attention and we can keep working, there are changes we can make that make a huge difference in Mississippi.
So correct me if I'm wrong. This is your first committee that you've chaired. Is that right?
Yes, sir. Uh-huh.
And you know, you're in your second term, and you know, I don't think no one thought that you would not be capable of chairing this committee, but it is, I would say, a little bit of a jump to go from, you know, not chairing a committee to chairing a committee as large and as detail oriented as the Public Health Committee. And you know, I wish, you know, the listeners could see here in the studio. You have a big Manila folder with lots of notes and bills.
Are carrying around a lot of paperwork. I've noticed.
I say all that to say what I think has been the most rewarding part of chairing the committee, and what have you sort of had to learn in the process of chairing the committee?
Well, as y'all know, it was second or third week when the speaker announces, and I had no input with the speaker as to what I wanted to chair or to be part of. I certainly wasn't asking for a chairmanship, but you know, when I was just listening to the list and we called public health and Sam Creekmore, I immediately went into prayer. I mean, I did. I didn't hear a single word after that. I said, "Lord, help me. You know, if a lot's expected of me, I want to do the best I can." And you know, for Speaker White to have that much confidence in me to do this is really, you know, that's an incentive right there. So I've tried to work hard and do my best and to be open to everybody. I mean, as y'all know, there's people in the hall of the Capitol all the time wanting to grab you and see you and visit with you. And I've tried to see as many people as I can. And I'll tell you, you know, Hob Bryan has been a good friend of mine, and he's a Democrat, and it doesn't matter. We're both in public health. He's been a good mentor. David Parker on the Senate side, the vice chair. So I've leaned on them a lot, you know, and Kevin Felcher is the vice chair with me on public health, and he's in the same class as me. So we've gone into this together, but with open arms and a clear mind, and try to attack as many things and prioritize as best we can.
Yeah.
You know, Delbert, I saw Delbert about halfway through the session, Lieutenant Governor Hoseman, sorry, and he's like, "Creekmore, you're sending too many bills over to the stop it." And I took that as a compliment. So we have worked hard, but to answer your question, the other part, Taylor, the biggest challenge is, you know, when you're not a chairman or vice chair, the procedures in the Capitol, and I respect them greatly, and and I'm thankful for them, because without that it would be total chaos in the Capitol and in committee meetings. But learning the procedures and knowing what goes and what words to say. I'll never forget. I was at the well, and I accidentally read I said I'd like to bring up House Bill 346. Well, that was the wrong bill, and so all of a sudden, it's too late. It's called up, so it had to be tabled, and I was just lost. And but we ended up getting that one done. But yeah, I've had to study the procedures and still don't know them all. But that's been the biggest challenge for me.
Well, you had in your first term, though, you had a keen interest in many of these same issues, correct?
Oh, yeah.
I know you mentioned your colleague, Representative Felcher.
Mm-hmm.
Y'all had already taken a keen interest in mental health issues.
Yeah,
and others.
Kevin's been great, and we didn't come at mental health as a team together. We both approached it and all of a sudden realized, hey, we're both working on mental health, and for different personal reasons that have led us this way, but now we're working collaboratively, and he's been great to work with. Everybody in mental health and public health. I mean, Dr. Edney y'all have had him. I interviewed him, and just they have a kind heart for the most people in public health are in it to serve people, and it's been very rewarding. And any way legislation can make their job easier, I try to do it.
Well, look, I know we've got to let you get back to the cap. Actually, we have to get back to the Capitol ourselves. We're getting into the short rows, so to speak, with this session.
We are. And let me, if y'all don't mind, y'all can edit this out. But I agreed to this interview, and I always enjoy coming on here. But in the legislature, we get the opportunity to honor great Mississippians or people who contributed to Mississippi. And yesterday, I knew this man named Alan Hunter who went to Millsaps. He's from Birmingham, who went on to be the first original video jockey for MTV. He was actually the first one when the MTV opened in August 9th, 1981. And many times, of course, I'm Generation X, so I was watching MTV, but I'd see Alan Hunter, and he had a T-shirt on that said Millsaps. And I was like, I figured this guy was from California or wherever, and I said, this guy's representing Mississippi and Millsaps. Well, anyway, he's coming to town. Millsaps having a symposium on the arts and theater, and I said, I want to meet Alan Hunter. I want to do a resolution for him and honor him. And y'all were so gracious to postpone this interview because Alan Hunter was coming to the Capitol, and but he actually told me, he said, I'm Mississippi's my second home, and any chance I get to promote it, and as a legislature, we appreciate that, and we like to bring honor to those individuals. We don't always do it enough, and we get always sometimes bullied and criticized for laws and not paying attention. But that was a true treat for me to have Alan Hunter in the state of Mississippi, and he's very gracious and very proud to be has spent time here. So thank y'all for postponing that. So
sure,
do that.
Of course.
No problem.
Thank you for sharing that.
We entering probably the final days of the legislative session. How optimistic are you that peace is going to break out between the House and Senate?
How it can change from moment to moment at the Capitol.
Right.
But when I left last night, I was very optimistic. I'm looking. I know it'll be Monday when this is aired, but I think, and I'm not part of that. We're close on Inspire. The education funding, I think, which gives me hope. It also gives me hope that we've never had Medicaid reform come through the House and Senate, ever, and now we're in conference. That's never happened. So that's gives me optimism.
Sure.
So, and who knows whether Inspire makes it or not, whether Medicaid reform makes it or not. That we've had these conversations. That's never happened. It's never been with either one of them. And to see what we've done in public health I've been very proud of that. So, it could all change for the better in a matter of days to next week, or it could go south. But either way, I think we'll be having this conversation. If it goes south, we'll be having this conversation again next year.
Sure. Well, thanks again. hope to speak with you soon.
Yeah, maybe.
Always a pleasure, Taylor.
Yeah, of course.
I do
maybe
like you.
Most of the time, you do. maybe
You are my neighbor.
That's right. We are neighbors. Maybe next time you can bring arguably the more popular member of the Creekmore family, your dog Mabel, to the podcast studio.
She would love to grunt in the podcast and
She likes
snort.
the Capitol, too.
She loves
right?
the Capitol.
Yeah.
And the Capitol loves her.
All right. Well, thank you so much for your
All right.
time.
Thank y'all. This was fun.
As we cover the biggest political stories in the state, you don't want to miss an episode of The Other Side. We'll bring you more reporting from every corner of the state, sharing the voices of Mississippians and how they are impacted by the news. So what do we need from you, the listener? We need your feedback and support. If you listen to the podcast on a player like iTunes or Stitcher, please subscribe to the show and leave us a review. We also have an email in which you can share your feedback. That address is podcast@MississippiToday.org. Y'all can also reach out to me or any of my colleagues through social media or email. And as always, thank you for your feedback and support. Subscribe to our weekly podcast on your favorite podcast app or stream episodes online at MississippiToday.org/theotherside. For the Mississippi Today team, I'm Adam Ganeshow. The Other Side is produced by Mississippi Today and engineered by Blue Sky Studios. We hope you'll join us for our next episode.